Hi everyone, this is Dr. Daniela Jesin, and with the newsletter this month focusing on solutions for pain management, I thought it would be an exciting and fantastic opportunity to speak on a form of pain that I'm seeing so frequently in my office. This is a form of pain that many women are experiencing commonly and potentially even monthly. This is menstrual pain. So I hear this so often. Women are told that experiencing some pain during their period is just simply a normal part of being a woman, something that they just have to accept and live with and deal with. But yes, while it is really, really common, experiencing pain during your period is not necessarily optimal or even normal. And so I love working with this demographic of people because there's so much that we can offer to help support women take control and gain control of their reproductive health and allow them to achieve painless periods. So, what do? Now, first and foremost, we always want to take a really root cause approach and do a thorough assessment to ensure that there may not be an underlying reason that someone may be experiencing more significant or more severe pain. But in a general sense, when looking at pain during our menstrual cycle, we really want to focus on number one, inflammation. Reducing inflammation can make an amazing impact and can be a huge factor in the experience of pain during our menstrual cycle. And secondly, we really want to focus on optimizing hormones in general. So female hormones, blood sugar, stress hormones, all of these hormones play a really, really major role in how we experience and what our experience is of our menstrual cycle. So how do we do this? Now, luckily, we have so many tools and so many modalities, and usually it'll be a really collaborative plan that incorporates many different tools to support an individual depending on what they're experiencing. But we always want to start with looking at lifestyle. So looking at things such as foods, what we're eating, what we're putting in our body, our environment, what is surrounding our bodies, right? All of these factors can play a huge role in inflammation. So making sure that we're nourishing our bodies with foods that agree with us and that aren't causing and wreaking harm and inflammation, and really, really optimizing our environment is a really great place to start. But beyond that, we often will also incorporate a tailored nutraceutical plan, and this can include things such as magnesium, just for an example. Acupuncture is also a fantastic tool in helping women to achieve their goals of reducing their pain during their periods. And even sometimes we'll use tools such as bioidentical hormones, for example, if needed and necessary. But what I really want to focus on and talk about today is a form of medicine that I'm so passionate about, that I've been utilizing so much in my practice, and that is herbal medicine. Now, why is herbal medicine so fantastic? Number one, it's very powerful and effective. But secondly, we can really create tailored medicines with it. So how I like to use herbal medicine is I'll pick specific herbs that help to address specific concerns that an individual might have. So for example, if they are having trouble with inflammation, I'll pick an herb that will help support inflammation. If they're having issues with balancing their female hormones, then we'll incorporate herbs that help support that, right? If we need to support stress. Basically, what we can do is look at the individual and pick herbs and create a medicine that matches what they're experiencing to help optimize and support their health in general, and help support their health in general, and with the goal of helping to reduce and optimize their reproductive health. So, that being said, if you are someone who's experiencing pain during your menstrual cycle, look no further. I'd love to work with you, and we can come up with a really comprehensive and individualized plan to get to the root cause of why you may be experiencing pain in the first place, and then coming up with a really solutions-oriented plan to help get you relief and hopefully create a situation where you're not having to reach for as many over-the-counter pain medications and can really feel that you're in control of your hormonal health. So I look forward to working with you, and thank you for listening.